Good evening, everyone. I would like to take this opportunity to thank our guest speakers for their valuable insight about capacity building in surgical care and about their time. You know, WHO defined capacity building as the development of knowledge, skills, commitment, structures, and leadership to enable effective health promotion. And to do it effectively, we need to focus on individual, organizational, and community. Building capacity is needed to achieve safer surgical care and prevent medical error. At present, one of the biggest deficits to capacity building in surgical care in Middle East and Africa region is related to staff knowledge and training in perioperative care. This is a reflection of the diversity of the nursing team, lack of standardization in the perioperative care, and lack of formal training and certification for perioperative nurses to help them be more confident and gain robust learning in best practices, leadership, and critical thinking to successfully foster quality and safety improvement in surgical care. You know, the right approach for capacity building in perioperative care is to develop a plan that strengthens the organization ability to achieve its mission efficiently and effectively. So we start by understanding the perioperative nurses' capacity. And as we all know, that perioperative nurses are collectively responsible to improve safety and quality in surgical care. So the big challenge for the organization is to understand the knowledge, skills gaps of their team. We at the Compass Health Consultancy, our vision is to enable healthcare organizations to enhance safety, quality, and efficiency of healthcare practices to achieve zero harm while maximizing cost-effective solutions. And in order to achieve our vision, we want to empower health professional organizations through knowledge transfer and coaching to execute to improve performance and revenue. Therefore, we partnered with AORN to deliver exclusively in the Middle East and Africa region an education and certification program that can help to build competency of perioperative nurses. Our partnership serves to establish a career path for perioperative nurses, to advance the perioperative nurses' skills, to deliver safe care surgery for every patient and every day, and to improve efficiency in surgical care. Gap analysis to perioperative nurses' skills is critical when we want to build a capacity building in perioperative care. We can help you to understand the knowledge and skills gap of the OR team by implementing perioperative guideline assessment tool that can help you to get a knowledge about the gaps of your operating team. You will have a benchmark of your team knowledge skills in surgical care, and guess what? This will help as well in their career developments to select the candidate that can help be a great leader in the OR. We started building nursing career path in perioperative care last year in 2022. We started in UAE. This year, we are starting in Saudi soon, and other countries will follow. We are offering a range of training and certification that really is critical to build capacity of operating room nurses. And all these training and certification are accredited by the American Nurses Credential Center. Starting by Periop 101, as Renee said, it's very critical, this program, because it is the ABC for any nurse to know about the best practice, evidence-based of why we are doing an OR all these intra preparations that can help to achieve safety and quality in operating room. We are teaching them through the Peri-Op 101, the etiquette in OR. So we are offering in the region Peri-Op 101 for ambulatory and Peri-Op 101 for hospitals. And this program is delivered within 2 months that we focus on the evidence-based that AORN guidelines are really updating it every year. And this course provides OR nurses with the up-to-date clinical skills, leadership. We work to build their confidence, their critical thinking, their branding, while excelling as a perioperative nurses to ensure optimal outcome for surgical patients. The program are certified by the American Nursing Credential Center, and there are 39.8 credit for the Peri-Op 101 for hospitals and 40.3 credit hours for the ambulatory care. And you know, at the end of the course, they will have an assessment to their knowledge. They should get 80% and above a score, and then they will get certification from AORN. We are delivering this program in hospital facilities as well as in Gulf Medical University, where we have a big simulation center that really we work with our instructors who are surgeons, anesthesiologists, infection control, preceptors in OR, leaders in OR, that we focus all our effort to build their capacity and focus on their weaknesses once we understand their gaps. And this is why we do a lot of workshops that really can help them in their daily life in the OR. And hospital, they use Peri-Op 101, report quality improvement, reduce training time for staff and educators while gaining stronger recruitment and retention. We are very proud to bring this program here in the Middle East and Africa to build the capacity and the competency of the nursing operating room. So the hospital who are looking to specialize their nurses in orthopedic, cardiac, and gastrointestinal procedures, Peri-Op 202 is the right program that it is tackling all the best practices and evidence about the surgery in orthopedic and in cardiac and in GI. And again, the courses are certified and credited by American Nurses Credential Center. And we do a lot of hands-on that really can help them in their daily life in OR. And what we are doing that we work closely with the hospital management to understand their need. We tailor the solution for them. We tailor Peri-Op 101 with the Peri-Op 202 needed, and we combine it and we deliver it to their team. To the one who's looking for specialization for pediatric procedure, we have the right solution and training for you. This is a new certificate program that we started this year in the region. We deliver it in 2 days, that we go through the patient pathway, especially the pediatric patients pathway, and the pre, intra, and post. And the surgical team will have a great insight about the anatomical and physiological knowledge and skill of pediatric. And whoever is looking to improve quality in surgical care, we are offering a 2 days education program that really address the risk and the most common breakdown in practices that lead to patient injury, inefficient process, and facility liability. And this program will raise confidence among the team, mitigate the frequency of near miss, and reduce the potential for sentinel events. We're focusing on the 3 KPI, usually most used in the hospital: surgical site infection, sterilization failure, and retained surgical items. And The last but not least, the Certified Nurses Operating Room. CNOR is the ultimate certification for perioperative nurses. This certification assesses the knowledge and skills of the perioperative nurses with the minimum of 2 years of clinical practices. Earning the CNOR certification is a mark of distinction and demonstrate a commitment to uphold the highest standard of patient safety and surgical care. And the good news, we're starting with collaboration with AORN, CNOR program preparation in UAE. It will be covering UAE, Saudi, and it will be in October. And we will be communicating about this program soon in our social media. You know, building your nurse's career path in perioperative care, it's very important because really it will help achieving your excellency in surgical care. And an effective capacity building process in perioperative care will help to improve practices and infrastructures in any healthcare organization. Capacity building, it's very important to commit to that process. We need to get the commitment, but it will be well worth it. It's a team effort between the healthcare organization and the training providers and make the team work. The appropriate training and certification will develop your perioperative nurses team and give them confidence through knowledge. We at the Compass Health Consultancy, we can help you transform your perioperative nurses team to excel and delivering the highest standard in surgical care. And thank you so much for your attention.